Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health, reporting for the week of April 29th, 2024. As health professionals rooted in Oakland, serving some of the most vulnerable populations in the Bay Area, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. The goal of the People's Health Briefing is to equip you with the best knowledge and insights to keep you, your loved ones, and your community as safe as possible. This week, after an update on COVID, flu, and RSV, I will touch on H5N1 and milk, as well as measles and Worker Memorial Day. Starting off with COVID-19, taking a look at wastewater. Nationally, wastewater viral activity level for COVID is considered minimal in all regions. The region where it is highest is the Midwest. It was the South for quite a while, but now the South has dipped a little lower, but really everywhere is considered minimal. And nationally, the last time wastewater concentrations were this low was last July or so. In fact, this time last year, which we can see all the way over to the left on this graph, we were actually a little higher than we are now. So hopefully this bodes well and will continue to trend down over the coming months, just like last year. But this remains to be seen. I think we're all looking forward to seeing some predictability with SARS-CoV-2. So here is hoping for some predictability. Flu and RSV are also continuing to come down finally, and certainly hospitalizations for both of those viruses have come down significantly. Here we can see COVID-19 and influenza hospitalization rates. And although for the week ending April 20th there, we can see that we're continuing to head down nicely. But it is worth noting that COVID hospitalizations are currently double that of influenza. So these are rates per 100,000, and again, coming down, but COVID continues to give us significantly more trouble than influenza or RSV. And as flu and RSV get down to negligible over the coming weeks and months, we hope it will continue to be the case that COVID causes a disproportionate burden that is year round. So, of course, we're hoping that this will not always be the case, but that is what we are dealing with for now. And now taking a look at hospitalizations, and I can say that this is the best COVID news we've had in a while. And that is that the week ending April 20th, 2024 appears to be the first week this entire pandemic that we have had under 6,000 COVID hospitalizations. So this is major, this is great. Of course, 6,000 people in 1 week or every week in the hospital is still a lot of people. And of course, none of our metrics are perfect, but all other things being equal, it really does look like we are in a better place as it relates to this severe outcome. So let's hope that this trend continues and that our peaks continue to get lower each year as they have for the past 2 years. This would be a very good trend to maintain. And now taking a look at COVID deaths, we see 648 reported for the week ending March 30th. So we know this lags behind. This is about a month old, but still, we expect it to continue coming down, following behind hospitalizations. Now, most of last June and July, we were at around 500 deaths every week, so we're still not quite that low yet, but hopefully we will get there and even improve further than that. But this is still a lot of deaths every single week, and we could be preventing some of these if we would decrease transmission, if we would ensure that those who are vulnerable stay up to date on their vaccinations, and that those at risk of a poor outcome get timely treatment, which of course means timely diagnosis. So these should be our goals: reducing transmission and ensuring appropriate access to vaccination and treatment. And on the variant front, I've been reporting no news is good news for some months now because the JN.1 has been dominant for a while. But unfortunately, this week there is news, and that is that a JN.1 descendant called KP.2 is taking off quickly and is now projected at about 25% of US specimens. So this remains a slight pet peeve here, which is that new variants don't get added to the tracker until they reach a certain threshold of 1%. By that point, the actual projections are much higher, and then they go back to prior weeks to update them. So we can see here that the grayish color, the KP.2, even though it wasn't on here the last time I reported, now you can see them kind of going back to acknowledge its existence. And I understand that there are a lot of variants. There's a lot to consider here, but it's just that by the time we see it show up on the tracker, like in this case, it's already a quarter of our specimens, or projected to be about that. So definitely glad we're keeping an eye on these things and that they are being sequenced, but I'm wondering if there will be more timely updates in the future. And here we have a timely preprint article called Biological Characteristics of the SARS-CoV-2 KP.2 variant. And in a nutshell, what they are seeing is that KP.2 has a few mutations that seem to make it more fit and able to outcompete other variants. And it is also evading prior immunity from a vaccine and or prior infection more so than JN1 does. So this is definitely not news we want to hear, but remember, these are results of seeing how this variant behaves in the lab. So it remains to be seen how it's going to behave in the real world. So we will, of course, be keeping an eye on that to see what happens as this variant takes over, which it certainly seems poised to do. And remember that we do anticipate a new formulation of a COVID vaccine for the 2024-25 season to come out this fall. And on May 16th, so just in a couple of weeks, VRBPAC, or the Vaccines and Related Biological Products Advisory Committee, which is that expert committee that advises the FDA, they will have an open session on May 16th to discuss and make recommendations on the selection of the strain or strains that will be included in the 24-25 formula. So I think we've all felt that we are just chasing behind SARS-CoV-2, which is exactly what we've been doing. In fact, that's literally our strategy so far as it relates to vaccine. We are chasing behind the variants, and we've pretty much stayed a step behind this whole time. We know that the current vaccine is against the XBB variant. So by the time that came out, we were already on to the next variant. But all the people who specialize in this and focus on this felt that it was basically close enough. It was good enough. So it will be interesting to see what happens this time. Will the formula be just JN.1, or will it be against this newer KP.2 variant, or will it at least target those concerning additional mutations that KP.2 has that JN.1 does not have? So we'll be interested to see what transpires on May 16th, and we'll keep you posted. And now taking a look at long COVID estimates in the United States. And I've gone over this in some detail in a prior briefing about long COVID, but this survey comes from an ongoing collaboration with the United States Census Bureau. And it is called the Household Pulse Survey. And every month they are surveying somewhere between 60 to 70,000 people. And it is providing somewhat real-time data. It's obviously just a sampling, but it does help provide insights and trends. And the link for this is in the post in case you are interested. There really is quite a wealth of information there. What I'm sharing here is the national estimate of people in the United States who have ever experienced long COVID. So this is out of all adults. What percentage have ever experienced long COVID? And we see here that it is 17.6%. This includes adults who have not reported having had COVID. So this is all adults in the United States, 17.6%. And we can see that that trend is increasing, which of course makes sense. As more people continue to get COVID, more people will unfortunately get long COVID. And without knowing how to prevent it, other than not getting COVID, and without having treatment, this obviously remains a huge concern. This graph and map shows the percentage of adults by state that are currently experiencing long COVID. So on the higher end, we have Utah and Wyoming, which are around 10%. So 10% of the entire state adult population is currently experiencing long COVID. Super concerning. West Virginia, Oklahoma, Colorado, also all over 9% of their entire adult population currently experiencing long COVID based on the sampling. And this was in a selected time period that is recent, March 5th to April 1. So this is pretty current. On the lower end, we have 4 states that are under 5%. These are Georgia, District of Columbia, Hawaii, and Rhode Island. And I appreciate the fact that looking at this map, you see that there's only one state, and that's the state of Vermont, where according to the methodology they're using here, their estimate is not reliable. So all the other states seem to have reliable estimates. So certainly this is a survey. It's not going to be perfect, but it is very informative and seems to provide reliable estimates for almost the whole nation. So something we will continue to keep an eye on. So things are headed in a good direction with flu, RSV, and COVID, but we've got a new COVID variant on the scene. We've got mounting burden of long COVID. And even though we do have less transmission of SARS-CoV-2 now than a couple of months ago, there is certainly no shortage of SARS-CoV-2 still circulating around in our environment. It's not gone down to zero anywhere since it has arrived. So let's strive to maintain our best practices for preventing the spread of all respiratory infections, but especially to avoid catching and spreading COVID so we can prevent those poor outcomes, which we're still having too many, and also including long COVID and post-COVID impacts. And remember that an additional COVID vaccine is now recommended for those 65 and up and those who are immunocompromised. For everyone else, the recommendation we seem to be settling into is an annual fall vaccine. We're waiting to see what the fall COVID vaccine formulation will be. And all the while, we are definitely rooting for more innovations in hopes that we can leave this variant chasing strategy behind. But for the time being, that is what we've got. Gather outside as much as possible. Warmer weather is certainly helping to make that possible. But if you are going to be mixing with others indoors, wear a high quality filtration mask like an N95 or a KN95. Do what you can to improve ventilation and filtration in your indoor spaces. You can monitor indoor air quality using a CO2 monitor to get a sense of your indoor ventilation and also to see the impacts of even small changes like propping open a door or cracking a window. Let's also strategically test and isolate to avoid spreading it to others. And if you do test positive, please isolate until you are negative because enough virus to detect is enough to infect. And we know that we can prevent spread even within households by taking precautions. Let's try to avoid infection and reinfection. Remember that catching COVID once and doing fine is not a guarantee about the next time. And every infection is a new opportunity, perhaps and even a compounded opportunity for long COVID and post-COVID impacts. And also, please don't push yourself. Allow yourself the time you need to fully recover. There are studies correlating not resting while sick with COVID with later developing long COVID. And either way, we all deserve time to rest and recover. I know that's not always possible, and I am going to touch on more on that in a bit. And remember that if you're someone who should be treated if you get COVID, you should know that now. Make a treatment plan with your physician now. Here are the approved treatments for those at higher risk of a bad outcome. And we are still waiting to hear about PEMGARDA, the prevention injections for those with immunocompromise, and we will update when we learn more. And now regarding H5N1, information is starting to come in. Most recently, we've seen these headlines that traces of H5N1 have been detected in cow's milk. And I certainly do think there are reasons for us to be concerned about the spread of H5N1 among cows, but so far this does not seem to be one of them. There are a few reasons why I don't think we need to be too worried about this finding of H5N1 in the milk at this time. Of course, we can never say never, but we have several things working in our favor. First off, what this is referring to was that fragments of the virus were discovered. So not whole virus, not virus that is capable of infecting or replicating. Remember, this was detected by PCR, and PCR is a way of amplifying in order to detect amounts of virus, and it can be small amounts. And this is why when we were doing COVID PCR testing, we would have to see how many cycles did it take to actually find the SARS-CoV-2, because if it was too many, then we knew that the amount was really small and maybe not significant, and maybe somebody was just at the tail end of an infection, for example. And so we have to be thinking about that. This is an amplification method when we're using PCR, and that was what they used to find these fragments in our milk. Now, of course, we don't want to find any fragments of any viruses in products that we're consuming, but nonetheless, it should be reassuring that what has been discovered so far is not whole virus. It's not basically capable of infecting or replicating. So they need to do more analysis. This is only a small sample so far, so they're going to need to do much more robust testing so that everyone can be reassured. But this finding of fragments in and of itself, those cannot actually infect you. Secondly, there is no actual evidence that we can contract H5N1 by ingesting it. So there's a lot of evidence over time that that's not how we would contract H5N1. Of course, we're dealing with new type of spread between mammals now. So that is one of the reasons why I think we need to be concerned about H5N1, that it has, it's now spreading kind of among different hosts. And I talked last week about spillover. So we've got to be alert. We can't take anything for granted. But as of right now, we really don't have any reason to think that even if there was competent whole virus in our milk, that if we then drank that milk, that we would contract H5N1 that way. So that is not likely. Again, we're never going to say never, but this is another piece of information that should be reassuring. Next is pasteurization. So yes, we would like to see more direct evidence, like someone in a lab having whole replication competent viruses in milk get pasteurized and then prove that it's been killed. We're going to need more of those studies to really, really rest assured. But a couple of things. They seem to be drawing off of information that pasteurization of eggs, which is actually at lower temperatures than pasteurization of milk, does effectively kill H5N1. Because remember, this is bird flu. So we've been dealing with this concern with eggs before now, and there is evidence that pasteurizing eggs at lower temperatures than we even pasteurize our milk kills it there. So we should have every reason to think that pasteurization will also kill it in milk if it were to show up there. And they're also doing some other measures, such as destroying milk from sick cows. So that's an added layer, if you will. So all of these things together, I think, should give reassurance about the safety of our milk supply. I think it's worth reiterating that we should not be consuming raw milk products. There are a number of other things you can get from raw milk, because we can destroy all kinds of viruses and bacteria with pasteurization. That's why we do it. So please don't drink unpasteurized milk. You really would be absolutely gambling at this point doing that, I believe. And it's probably worth avoiding cheese and other things that are made with raw milk product, and that goes for cow's milk as well as goat's milk, because they have actually found H5N1 among goats and sheep as well. And now for measles. We've got 128 measles case in 20 jurisdictions so far in 2024. West Virginia recently reported their first documented case since 2009. And since then, they've learned of 152 more people who were potentially exposed. So they're now having to do that legwork involved with trying to contain that situation. And this is becoming a little too frequent this year, with a number of outbreaks that are having to be addressed by our public health departments across the country. Remember, we had achieved elimination status of measles in the United States. So as of the end of 2023, we still had elimination status. So it remains to be seen whether we can maintain this in 2024. In fact, there was a morbidity and mortality weekly report earlier this month reviewing measles cases over the last 4 years. Well, last 4 years and a quarter. So looking from January 2020 to March 2024. And first of all, unfortunately, about a third of the cases during that time period were in 2024. So just those first 3 months of 2024, a third of the cases in an over 4-year period occurred. Also, the point they wanted to get across here is that they were almost all in people who were unvaccinated or whose vaccination status was unknown, and also primarily in those who had traveled or who had been around someone who had traveled internationally. And note that we are having increases of measles worldwide. We've got some ongoing outbreak situations in the UK. So not necessarily places where we were normally concerned about traveling to for measles, but that has all changed now. So if you will be traveling internationally, no matter where you're going, please make sure you're fully vaccinated. If you're traveling with an infant between 6 months and 1 year of age, the likely recommendation will be that they get started early on their MMR series to protect them on the trip. So please check in with your physician about that. And now I want to end with an acknowledgement of Workers' Memorial Day, which was on April 28th. And Workers' Memorial Day is something that has apparently been recognized in many different places internationally, and I think to different degrees in different places. But Governor Newsom recently issued this proclamation that sort of recognizes and affirms Workers' Memorial Day to pay tribute to fallen workers and to recommit support of the welfare of our workforce and ensuring healthy and safe workplaces for all Californians. And there was acknowledgement of the loss that we have experienced of essential workers in the COVID pandemic, particularly in the early years of the pandemic. So California was really at the forefront of protecting workers very early on. In March 19th of 2020, the governor issued the executive order that directed residents to stay at home except for essential workers like healthcare workers, emergency responders, agricultural workers, food production workers, retail workers, and a lot of the trades workers, as well as transportation and other types of organizations that were providing direct critical services to the population. And individuals working in essential jobs during the early years of the COVID pandemic had a higher risk of getting SARS-CoV-2 and a higher mortality from COVID-19 than those who are working in non-essential work sectors. And we know this, and we remember celebrating our essential workers, we also lost too many of our essential workers. And these are things maybe we'd like to forget, but I firmly believe that we cannot. I think remembering and acknowledging is a critical step to healing. And as I've said many times here, I don't think we've come close to healing from the collective trauma that we've experienced. And that is manifesting in many ways. And we're going to discuss some of those in an upcoming briefing on the mental health impacts of the pandemic. But let's not forget that in the first 2 years of the COVID-19 pandemic in particular, we lost too many of our essential workers. Here in California, those who worked in healthcare, manufacturing, and transportation had some of the highest death rates among any professions or any types of work. So I'll say that a memorial is nice, but what would really honor those who've lost their lives in doing their role and doing their work would be to honor current essential workers by protecting them. Now, don't get me wrong, California has led the way in many respects on many fronts in terms of protecting its workers. But as a country, as a nation, I will say that it's pretty disappointing that even after a pandemic that has killed so many people, and even after we supposedly recognize the importance of our essential workforce, that we still don't have basic things like a federal sick leave policy or adequate PPE requirements in many settings, including in healthcare. So it's no secret that I believe that healthcare staff should be masking for the safety of their patients, but also for their own safety as well, and that of their families and their households. So we need adequate worker protections, and we should tap into all the innovation that has come about because of this pandemic. So we need to not be putting our head in the sand. We need to acknowledge that we do have a continued and ongoing situation where COVID is being transmitted around, and particularly to vulnerable people. And so we need to keep getting better. We need to improve our indoor air quality. We need to invest in better ventilation and filtration. What about using some of the innovations that we've seen that I've talked about here, like the machines that can test and pick up SARS-CoV-2 or flu in ambient air? What if we had those in hospitals and clinic reception areas? And then we could just be smarter about how we're protecting ourselves and protecting the people around us. And how about implementing appropriate sick leave so that people can truly get that rest that I mentioned is so important if you're sick, particularly with COVID, to take the time that you need to fully recover and to isolate from others so that you don't make them sick. These seem like such basic things. I had such hope that we were going to adopt these things. And unfortunately, it seems like in many regards, we are putting our heads in the sand. So I am glad to see that there's a memorial. I think the day came and went without enough acknowledgement. And so I think that is an area that we can do better, but especially, I think we can do better by actually protecting our essential workers and those that they interface with. And please remember, if you do not have a primary care provider, please get one. Don't wait until you need them to try to find one. Know how to reach them before you need them. Get your blood pressure and baseline labs checked, like sugar and cholesterol. Establish a relationship with your primary care provider. We all deserve to have that healthcare person who knows us and who is in our corner. And remember to eat a balanced, nutritious diet, incorporate fresh foods, eat balanced meals, avoid sugary drinks and processed foods, get some regular physical activity, unless you don't feel well. In that case, please get your rest. Manage your stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Thanks so much for joining us, and we will see you again next Tuesday at 10 a.m.